Assalamu alaikum. My name is Sayyid Mudabbir Hussain, roll number 2021 DBM 200. Today I will be presenting a case study titled Amputation of Uterine Horn in a Goat. This case highlights a rare reproductive condition and an uncommon but successful surgical approach. Let's begin. Introduction. Fetal maceration is a rare condition in goats. It occurs when the fetus dies inside the uterus and begins to decompose. The soft tissue disintegrates over time, but the bones remain inside the uterus, causing the chronic infection and inflammation. In most cases, if treatment is delayed, the uterus becomes severely damaged, making normal delivery impossible. Case history. The patient was a 4-year-old doe weighing around 22 kilograms. At full term of pregnancy, the owner reported a foul smelling discharge for the past 10 days. On the clinical examination, the goat appeared dull dehydrated and had elevated body temperature. A vaginal examination showed that the cervix was barely dilated on enough to pass one finger. Fetal bones could be felt inside but could not be removed through the birth canal. Based on these findings, the case was diagnosed as delayed fetal mass. Clinical findings. The mucous membranes were congested and the body temperature was around 39.9 degrees Celsius. The doe showed continuous straining, but the cervix remained tightly constricted. Because the cervix failed to dilate, manual bone extraction was not possible. This made the situation more critical as prolonged retention of bone can lead to perforation, sepsis, and death. Treatment and stabilization. The first priority was to stabilize the animal. IV fluids, dextrose, and dormousine was administered to correct the dehydration. Medication including DEXA and broad-spectrum antibiotics like ampicillin were given. Despite the supportive therapy, the cervix still did not dilate. Therefore, a C-section through the left flank was selected. The left flank approach was chosen to reduce the risk of contamination from the infected uterine contents. Surgical finding. Upon opening the abdomen, the right uterine horn was found to be severely damaged. The fetal bones were tightly adhered to the inner wall of the horn, and several sharp bony edges were nearly perforating the uterus. Because the bones were firmly embedded, removing them one by one was impossible and would cause further damage. This left the surgical team with only one visible option: amputation of entire affected uterine horn. And post-op care. The right uterine horn was carefully amputated and ligated to prevent bleeding. The remaining uterus was flushed thoroughly with normal saline to minimize infection. The abdominal incision was closed using standard laparotomy procedure. Post-operatively, the doe received antibiotic NSAIDs and antihistamines to reduce the pain and prevent infections. The sutures were removed on the 15th day, and the goat made a complete and uneventful recovery. Discussion. Typically, fetal maceration in goats is managed by manual extraction or C-section. However, in this case, both methods were impossible because the extensive adherence of the bones to the uterine horn. Amputation of the uterine horn is extremely rare in goats, with almost no previous reports. The successful outcome highlights how innovative making and timely surgery can save an animal, even in a severe reproductive emergency. In conclusion, unilateral uterine horn amputation proved to be a life-saving procedure. The doe recovered fully without complications. This case is significant because it represents one of the first documented successful attempts of this surgery in goats, making it a valuable reference for the future vet practice. Thank you for listening to my presentation. I hope this case study provided useful insight into advanced reproductive surgery in goats.